Uh, Thank you, Dr. Partho, for this invitation and Ajanta Pharma for this opportunity. So, small people itself is a challenge, and I'll see what challenges we can add on to it and how the B-HEX helps in resolving these. I'm Suven Bhattacharjee, and I do have a financial interest as the owner, the inventor, and the owner director of MedInvent Devices. And I gratefully acknowledge the contribution, the video contributions from the authors listed over here. Their names will be there on the videos as I show them. So the B-HEX is as small as that. As you can see, the actual size to the matchstick head, it's just 6.5 millimeters, and it's as thin as a human hair. It's got 6 flanges and 6 flexible notches at the corners and tabs for holding. It's a US FDA registered. So now this is a normal case where we just show the inject viscoelastic under the pupil margin and a little bit over there so it just doesn't jump out, and then we tuck alternate flanges under the pupil margin. This is a normal case, I'm just showing for context. And then we do a capsulorhexis and the Phaco. The 5.5 millimeter or 5.75 millimeter pupil dilation that this provides is more than adequate for any cataract surgery, and it's as well good enough for safe IOL implantation, and you can go under the IOL and remove the viscoelastic as you would do in any other case. And you have a wonderful round pupil at the end of surgery, and that's very gratifying on post-op day 1. Now, this is a hard cataract, rigid pupil, and a little bit of subluxation also with pseudoexfoliation. That's the reason for subluxation. This is Dr. Deepak Magur. And if you will see, it's the same 5.5 or 5.75 millimeter pupil, and it's a pretty hard cataract. And there is really no problem in removing a hard cataract to this pupil size, because all you need to do is chop it into small pieces and the job is done. And you have a wonderful round pupil at the end of surgery. Now, this is Dr. Saurabh Patwardhan, a real challenging case which required a 57 diopters IOL. You can imagine the shallowness of the anterior chamber, the bulky lens that is there, and that is the B-HEX pupil expander being placed, and that's a sizable pupil. Again, this is the second time that the trypanbu is being painted over there, and then Phaco emulsification, and you just see the lens. That's it. 57 diopters, and that was really helpful. The B-HEX really helped over here. The surgeon implant the lens safely in this eye. And removal of the B-HEX is probably the easiest step among all pupil expanders. It's just hassle-free, just practically it walks out. Now, this is available on the American Academy website. This, I thank Dr. Michael Henry and Deepak Edward for the surgery. This is got a glaucoma tube shunt, and you see how the third flange, after the second flange is engaged over there, the third flange goes around the tube shunt. See, there you are. That is the third flange going around the tube shunt, and that provides enough pupil dilatation. It may not look perfect, but it serves its purpose. The pupil doesn't come down, so it serves as a pupil retainer over there, and that way you have enough visibility for a safe phacoemulsification and IOL implantation. And as I said, removal is not a problem, and in an eye which has got a tube shunt, a thin device like the B-HEX, which is just 75 microns, helps a lot. Now, this is intraoperative miosis, so you have to take a call during the surgery. Now, once the pupil comes down to this level in a hard cataract, you really don't want to take your chances and push your luck too far. You don't want to tempt fate. So you again inject viscoelastic under the pupil margin and over the capsulorhexis rim and create space, and you then tuck alternate flanges. Now, the advantage with the B-HEX is you get instant confirmation that the capsulorhexis margin is not engaged. That doesn't happen with other devices where actually the scrolls are there, and that doesn't allow you good visibility. Now, this is by Dr. Pradeep Mahanto. Look at the removal of the pupil membrane over here. That's a wonderful surgery there. Yeah. Now, he does do a stretch over here, but once the pupil membrane is removed, you really don't need to do that stretch, and it will. Now, this is a 70-year-old lady with an intumescent cataract. You can see the shallowness of the anterior chamber. It's extremely shallow, and that is where the thin profile of the B-HEX and the single plane, uniplanar device that it is, offers the huge advantage. There you are, the B-HEX place with the 23 gauge forceps that is used over here, and there was a subluxation over here. So CTR goes in place, and all of that without any hassle, just like as if it was a routine case. This is a flax surgery by our good old friend, late Dr. Ajoy Paul, a very good friend of ours. And this is after flax, the people came down. So this is when the B-HEX was useful. Putting the B-HEX over there offered good visibility for safe phaco surgery. So it's, you can use this device at any point in surgery. In fact, there are some more where you can do it at the IA stage after cortex removal, just for the IOL implantation. If you have doubts, you can always use it. There you are. And of course, we do have B-HEX used in posterior segment surgery, which will just follow here. This is an award-winning video by Dr. Devdulal Chakraborty. So this is a case which had recurrent retinal detachment, silicone oil injected with PDR, and that's where after the membrane removal, you can see the B-HEX offered visibility of the break in the extreme periphery. You just see that break in a while. There, that is the break which is seen, and that's how the B-HEX helped over here and this patient. So the B-HEX can be used in any form of surgery, wherever you need to see beyond the pupillary plane and the size of the pupil is posing a problem in between. So to sum up, it's a single plane device with hexagonal shape, notches and flanges. It's ultra thin, 75 microns, just as thin as a human hair, and it can go in actually through a 1.2 millimeter incision and come out through a side port 0.9. For the constraint of time, I'm not showing those videos. There is no snagging of the incision. There is no injector needed. It's just very user-friendly and actually idiot-proof practically. So you have better control with B-HEX forceps. You know, the B-HEX forceps allows you to do the job where it is required at the site of action, unlike most other devices. And it's a very short learning curve. Average skill is good enough. You really don't have to be a very skilled surgeon for this. Thank you very much for your attention.
Thank you very much, Shubhen. And I think all of us use B-HEX, and we have seen Shubhen's B-HEX generate over the years, getting more and more friendly to use, especially with the forceps. I remember the time when we used to use the dialer.
Yes.
But the forceps has become really, really friendly to the use of B-HEX, even in very small pupils.
Yes.
So thank you very much.
I'm grateful to the fraternity for
Thank
the
you.
support.
Thank you. We have to compliment Suven. Give a big round of applause to Suven for an amazing innovation.
Thank you.
Amazing innovation. So
please.
good. Made our life very easy.
Thank you very much. So we come to the next talk, and that's by Dr. Chitra Ramamurthy, Challenging Moments in Hypermature Cataract. And being a refractive surgeon, a glaucoma surgeon, and even a very good cataract surgeon. Dr. Chitra.
While she's getting ready, Suven, I just need a very small pupils. I find that your B-HEX, because you say you should stretch the pupil. The problem is when you stretch the pupil, you're not under good control over the pupil size and the shape. You can tear the sphincter. So how do you control that when you stretch the pupil and then use the B-HEX?
Very good question, Mohan.
Yeah.
Now, the size of the pupil is actually immaterial. It's the nature of the pupil. Remember, it's the nature, whether it's rigid or elastic. And that decides. So it was, though it has been in literature for a long time, during my work on the B-HEX, I realized that in some cases I was getting away with it, and in some I was getting stuck. So that's when I realized the importance of David Chang's paper on IFIS. So elastic pupil, the size doesn't matter. It's like a rubber band. You can stretch it. It's the rigid pupil where you need to stretch it and stretch it and make it to about 4.5 or so for the B-HEX to work. The B-HEX does not have the mechanical strength to break.
It will not tear. It will not tear when you stretch.
Yeah, it will tear. See, in any case, any rigid pupil, whatever device you use, even if you use iris hooks, it's a string. So the difference is between a string and a rubber band. Very simple.
Yeah.
A string has to be torn. It will not stretch. It's got a fixed circumference. So if it's 3 millimeter string, you have to stretch it. So you will cause sphincter tears. Like it or not.
Thank you.
Thank you very much. We have Dr. Jatinder Singh Bhalla, and Dr. Bhalla is going to tell us about negative dysphotopsia and unraveling the enigma. It indeed is an enigma. You do an excellent IOL, you place everything well, you give a premium IOL, and then the patient comes up with a very, very sour face and says, I'm seeing all sorts of shadows. Yeah. So Dr. Bhalla to tell us about dysphotopsia.